Well, we're here today with Dr. Patel, a dentist in the San Bernardino area in California. In fact, Dr. Patel, I think you have 4 offices in different cities. Which cities are those?
Well, we are situated in Claremont, which is a college town, San Bernardino, Montclair, and Colton are the 4 cities that we have practiced in for quite a while.
Quite a successful man, it looks like. Dr. Patel, let me ask you a couple of things here. Number one, when we people, the laymen's, the people who go to a dentist and who know nothing about a dentist, when we go to a dentist, we have somewhat a small dilemma. On one hand, we believe that every dentist is the same because you guys, after all, graduate in particular universities and you're licensed by the government. So, how much different can you guys be? And at the same token, we keep having that feeling that, no, that's not quite true. Different dentists have a different type of personality and a different type of, belief on how they do things. And I want to find the right guy for me, almost like a marriage, maybe not quite as heavy, but, some trace of it. So tell me a little bit, in your practices, what can a patient expect? Is it a practice where you come in and all you get is the Tom Cruise, Julia Roberts type of smile? Or can I come there with my family or myself and say, look, I know I need a lots of work in order to have a beautiful smile, but I really just need this thing functional. I need to make sure that I have no disease in it. The prettiness, hopefully I can afford in a few years, but surely not now. Basically tell me, what can we expect? And maybe, if you're at it, maybe you tell us what made you becoming a dentist, Dr. Patel. It's always interesting to people to know.
I would firstly start with why I became a dentist.
Well, all right.
When I was born in Mombasa, my father's best friend was a dentist. And I constantly played in his lab.
Mombasa is a country in India, I assume.
Mombasa is the little island just off the coast of Kenya in Africa. That is where I was born.
What do I know?
Having been born in a country where obviously I'm 58, so care 58 years ago or 50 years ago wasn't that great. And here I was with always visiting my father's friend and looking at what he did and the difference that he made in people's lives. They would come in, mostly they were poor people that had problems with their teeth, and their teeth would need to be taken out, and they would have some teeth made, and how he made those teeth and how he helped them function again. And it interested me very much. And so I decided at a very young age to become a dentist. To answer your question, yes, every dentist has the necessary skill to practice in California. Otherwise, they would not be licensed. But how do you choose a dentist is really entirely up to a person. Most of the time, they would choose a dentist from family friend referrals. Other times, they go to the internet nowadays. What I have done in my life, I've been a dentist now for 34 years. I've practiced in England for 9 years before emigrating to California. In my observation, the best way to provide dentistry to a patient is to, first of all, have listening skills. Patients don't come in and want the dentist to decide what they need. Patients come in and they want them to decide what they need. So I started my life like that. When you come in, the first thing we do is, what are your needs? How can we help you? And in doing so, I created dental offices that provided care for children from the ages of 2 years old to adults the ages of 102. And the reason why I did that was such that people did not have to run around half the town. they needed root canals, or they needed a children's specialist, or they needed braces, or they needed surgery, or they needed implants. We have tried to create a team of people that have been together now for almost 20 years. The same oral surgeon, the same periodontist, the same orthodontist, the same children's specialist, and the general practitioners that work with me, like Dr. Fountain, Dr. Cox, Dr. Miller. All these men are very, very educated after graduating, after getting their license. They go and do at least 50 to 100 hours of continuing education, so their skills are at an optimum. If you have a problem, if you are not satisfied, we are there to correct your problems. And so the philosophy is,
go ahead. Go ahead about it, because you just said, we said a little bit ago, and you said it, that yes, people have skills, and we don't want to diminish those skills. But I think I got your philosophy that listening to people and giving them what they need and want.
Exactly. So the philosophy is, one, to be able to be global in dentistry, being able to provide all care that they need under the same roof, if they want us to provide that care. Now, if they have an oral surgeon that they have been to before, that they liked better than Dr. Hickey, who is 37 years an oral surgeon, who used to practice in Upland for so many years, or they have seen somebody else that they like, they can go to that person. We do not refuse that. So the intent is to be listening, to be providing care that the patient needs, to be affordable, and to help the patient. Always help comes first. Became a doctor because wanted to help people.
Right. So when I come in and all I want, not need necessarily, but all I want is taking care of that one or two tooth, which might need some periodontal, might need a root canal, whatever it is. Even though there is other work in there, obviously your office probably will make me aware of it and will then tell me the importance of it. But you're not there to, in another term, I come to buy a Honda and you want to absolutely sell me a Mercedes, because it's just so much better. That's not going to happen in your office. I can get
Definitely not. Definitely not. The patient comes in, they tell the girls, I only want one x-ray of the tooth that is bothering you. If I am the dentist treating that patient, I always go and tell the patient that, yes, you are paying me for a consultation, so if you don't mind, I will make sure that there is no cancer, there is no other problems. I will inform you of the problems that I see. However, I will concentrate on what you want me to do is take care of your problem today.
Beautiful.
If they choose to come back and do something else, that is different.
Well, obviously, you're having 4 offices, so people seem to be choosing to come back in a relatively a high quantity.
Yes, they do choose us quite a lot, and they refer their friends, they refer their families, they write good reviews about us. We have been in business now for 24 years since emigrating from England. So my total years in practice.
Let me ask you, sorry to interrupt you, especially since you put so much attention on listening is important, but we have some time limitation here. So let me ask you, do you feel that having worked in different countries like England, I'm sure you guys need to take different tests over there because they're not, you can't even practice in Texas and in California, so I'm sure you cannot practice from England to here. You need to again take different tests and basically a different mentality. Do you think that having, so to say, seen different ways of doing it, however different they might be or a little different, that is an advantage for you to kind of, because I have been in the food business for a long time, and having been in many, many different countries, it gave me a tremendous advantage just knowing how other people eat, how they not eat, and what exists, type of stuff. Is that the same case in dentistry?
Definitely so. The English people do not come in because they have a crooked front tooth. They come in because they need some restorative care, or they have a cavity, or they need cleaning. Here, people are more conscious about their smiles. They want white teeth. They come in with other needs besides just having a cleaning or maintaining their gum disease or making sure that they don't have cavities. Don't get me wrong, not everybody comes in to improve their smile, but needs are different in different countries. And affordability is different in different countries. People do not spend as much money in England on their teeth as they would here in California, for example. So yes, there are vast differences in the ways people demand care.
Well,
Under the National Health Service, patients wait 4 or 5 months before they can be seen. Here, patients want to be seen the day they call, 10 minutes later.
Right, right.
So it makes a big difference.
Right. Well, maybe that is part of the reason why America has become what it is, because, we want more, we demand more. And of course, when we want more, we always demand more from the other people. So that's why probably professionalism in America is pretty high.
Our skill levels have to be very high because we have to provide the care that they need. And the important thing that a dentist needs to be able to do is that the patient walks in, and let's say I'll give you an example of a sedation patient, a patient who is very afraid of the dentist. We do sedation dentistry, so we put people to sleep or we give them a tablet to help them relax. But those kind of patients do not want to come in 20 times.
Right.
They want to come in one time.
Right.
So the dentists that work with me, they should be capable of doing everything that the patient needs at one time.
Yeah. Well, that's what struck me. That's what struck me most. That you from your interview basically come in, get fixed what bothers you. Yes, we'll make you definitely strongly aware what else needs to be done in terms of clinical and what else could maybe be done in terms of pure aesthetic, and then leave it up to the patient. Dr. Patel, we're out of time.
Most of the time, we do not bring up aesthetics unless the patient is there for an aesthetic consultation. Because I noticed that a lot of times patients will go in and they're told, oh, you need luminaires. Why? Right. They need to tell us that they need luminaires.
That's like me walking in a store and a guy tells me I need a $300 shirt, and I go, really? I'm quite fine with the $20 ones. That's what I'm wearing now. And the guy might say, well,
so aesthetics.
Yeah, got it. I got it. Beautiful.
Yeah.
Beautiful. I can see why patients feel comfortable in your practice. Dr. Patel, thank you very, very much.